So I'm really happy to have a chance today to tell you about the research we've been doing for the past 6, 7, 8 years about the high incidence of pediatric cancer in Nebraska. This I will tell you that this Graham or Matt, I think one of them mentioned Dr. Alan Kolak, who deserted us and went to Idaho, but it was because of a conversation that he had with Dr. Don Coulter, who's the pediatric oncologist who sees almost all the pediatric cancer patients in Nebraska. And Don was very frustrated over the fact that of this high incidence that you'll see of pediatric cancer, and wanted and wished he had why is this happening in Nebraska? And so Alan said, they said, well, maybe it has something to do with the water in Nebraska. And Alan, who's an aquatic toxicologist, said we could study this. And that's where these studies all began. So we decided that we would study nitrate, and we've also done some studies of atrazine, but I'm not going to tell you about that today. It doesn't add too much to my presentation. I'm just mostly going to talk about nitrates. And as you know, nitrates are a problem if the levels are too high. And this is a well-known problem throughout parts of Nebraska. And by and large, they come from fertilizers, animal waste, and also human waste. But the human waste is less of a problem in rural Nebraska. One of the big problems here in Nebraska, at least from our point of view, is that private wells are not regulated. So they're not, on the whole, they're usually not tested very often, and people have no idea whether the water they're using for their families is good or not. The Environmental Protection Agency has set a limit of 10 milligrams per liter of water that they consider safe. However, I'll tell you that they are now considering lowering that limit because of recent research. That limit was set for the problem in some newborn babies called methemoglobinemia or blue baby syndrome, and which is caused by one cause of it is high nitrate. And as you can see, there are other kinds of health problems that have been associated with high nitrate levels. There also are adult issues. In addition to pediatric cancers, there are some adult cancers that have been associated with various kinds of cancer. And you can read the slide, so I'm not going to read them out to you. But you can see that on the whole, these associations, while it's very difficult, I mean, someone in our research group recently, sort of commented, it's too bad we can't just take a bunch of people and put them all in cages and treat them with certain things, and then we'd know if this is, a real straight cause and effect. Well, you can't do that, fortunately, with humans. And so these are more complicated, but you can see that there are a number of studies that have shown associations between exposure to high levels of nitrate and various types of adult cancers here. And as I have the same kind of information here about children, it's clearly established that high nitrate causes blue baby syndrome. The studies that have been published thus far have been, on the whole, positive in showing an association between exposure to nitrates and these various kinds of pediatric cancers. So, and here's just a little bit more data. I wanted to put this in and just show you that this isn't just our work. This is recent work from all over the, primarily the United States here, to show that there's a relationship between exposure to high levels of nitrates and these problems for children, health problems. And you can see that, for example, in the California study, the levels they had levels of 5 to 10, so below the EPA limit, but they were still seeing these health problems. And so let me continue on to the problems in Nebraska. So here's a map, obviously, of the United States, and you can see that Nebraska is at that point was 7th. It stayed about 7th. Sometimes it's 5th, sometimes it's 7th. It's right around in that area. Highest incidence of pediatric cancer in the United States, and it stands out in the Midwest. Most of the rest of the states are up there in New England. So we have a problem in Nebraska that we don't understand. Now, the first thing we did when we started this study was we got, fortunately, one of the good things Nebraska does is in 1987, they established a cancer registry, and it's required for all physicians when they treat a new cancer patient, they have to report this to the Department of Health and Human Services, and they have this really good cancer registry. And we applied to the cancer registry and asked for their data up through 2014. We also asked for the data, as you can see, on birth defects, and these show the data from 1995 for 20 years. And it's color-coded. The one, I never understand why this comes out as pale yellow, because it's really supposed to be white, but anyway, the pale yellow areas are areas where there are so few people that we can't calculate anything, a reliable number, because an incidence is how many cases, let's say, of pediatric cancer per number of children, you know, year by year by year. And so, not just new children, newly born children, but the total number of children in an area. And so we calculated that. And what this map shows is the state of Nebraska divided up into watersheds. I imagine most of you are familiar with the term of a watershed. It's the area where water collects in an area. Now, you could talk about, if you wanted to, the Mississippi River watershed, that one, or the Missouri River watershed. Neither of those are very useful in this context. And there are, and so you can do smaller watersheds, and you can get down to really tiny ones. We picked a level here that gives about 75 watersheds within Nebraska. We thought that was a reasonable one to use. And then, as you can see here, there are areas, the dark brown, as you might guess, these are higher levels of higher incidences of cancer, pediatric cancers in that area compared to some of the light brown areas. And so, as you probably could all recognize, that's the upper Elkhorn watershed. Then right below it, there is the lower Elkhorn River watershed, etc. So we see that cancer isn't just distributed all over the state. It tends to be in pockets in certain areas. So that was the first thing we established. Then we went on to the actually much harder task of trying to collect all the data and analyze all the data on nitrate and atrazine. We just picked atrazine as kind of a highly used, sort of a sentinel pesticide, that agrochemical, that we thought that was a good one to choose because we had to choose something. And so we got those. There are big databases. The EPA has a big database. The USGS has a big database. The Nebraska has something called the Clearinghouse. That's another big database. All of these overlap some. And all the water, you know, they have thousands and thousands of pieces of water quality data with lots of different elements and chemicals. And we are, actually the graduate students, fished out the data on nitrates and atrazine and got it all normalized so it all matched in terms of units. And we looked at that. Now that's, the problem with those data is that all of those measurements were done by some agency for a particular reason. And so maybe they would focus on this one area for a few years, and then they'd finish up whatever project that was, and they'd go to another area. So the data are very spotty, both in a temporal sense and also, 1 year they're here and the other next year they're there. And so it's not all the same places. So you have lots and lots of data all over Nebraska, but it's not the most satisfying data to use. However, we put it all together to see what areas over this same time frame had high levels of nitrate and or atrazine. And we began going on from there. So before I get to so that's how we did the water stuff. This is looking more closely at the pediatric cancer incidence data. In this set of graphs, the pink watersheds are those where the incidence of pediatric cancer is higher than the national average. And the green ones, it's lower than the national average. And as you can see here for central nervous system, CNS tumors, which include brain tumors, that it covers a good portion of the state where the incidence is above the national average. And that's those are about roughly 25% of all the pediatric cancers in Nebraska. Then this second graph over here, this one is leukemia, and you can see there are a goodly number of many of the same areas that are higher than the incidence is higher than the national average, and the same thing is true for lymphoma. Between each of these is about 25% of the pediatric cancers. And then there's a variety of other cancers that make up that last 25% in Nebraska. So out of curiosity, we could see this map, this last map that we have here, and that is a map of what's grown in these areas. This area that looks primarily green, but it really has black dots in it too, because that's corn and soybeans. And then over here, the purple areas or lilac areas are wheat. But we got interested in the fact that this map with all this green area looks a lot like, it resembles a lot all these pink areas. However, I have to tell you, we tried, to see if there was a statistical correlation here based on the amount of the sale of, let's say, nitrate, or no, the amount of the percentage of land in each of those counties, which was devoted to agriculture, which was a publicly available piece of data we could get, and did that correlate with areas where the levels of these cancers are high, and we did not get an exact correlation. There could be a lot of explanations for that, but that particular simple-minded approach didn't work. Thank you, Graham, very much. However, we've gone on from there. I just wanted to show you the actual numbers behind those maps, where you can see that the incidence of pediatric cancers, the brain and other CNS tumors, it's 4.05, and that's that's significantly above the national average for all the states. And then these other two, lymphoma and leukemia, are about similar to the national average. So it's really brain tumors mostly that are driving this incidence to make it so high in Nebraska. This is a county map instead of a watershed map, but you can see that many of the same places areas in Nebraska that have high levels of pediatric cancer also have high nitrate concentrations. Again, these data, I'm not exactly sure. I think these are data that we calculated ourselves. It just happened to be for a study that went for counties. So what we've done in this map, I want to show you this last map. What we've done is to say, okay, the average, this depicts all of the areas about the CNS tumors, whether they're above average, the national average, or below the national average. And then the area, the watersheds that are outlined in black happen to be ones we selected that some of them are high nitrate and some are lower nitrate. But we're now, we want to use these as areas that we would study in particular. And you can see we also have some outlined in green here. These areas, both the upper and lower Elkhorn, we're particularly interested in. And we have we've been collaborating the last few years with the lower Elkhorn NRD and also the upper Big Blue. This is another area that's got a very high incidence. It's got pockets of pediatric cancer that are really puzzling as to why there would be pockets there. And we are focusing there. We've been the last year or so in collaboration with the NRDs, we've been collecting domestic water samples. The NRDs have been very, very good at, they go in and identify homeowners there in rural areas. We're looking for people who have their own private wells, and they sample the water so that we can analyze it. They sample it before it's treated with if the home happens to have some kind of filtration or reverse osmosis kind of filtration, that they do it prior to that. So they know what's coming out of the wells, so they know that it's the groundwater that they're sampling. And I can't tell you the data for that because we're putting it all together now. But that's where we are right now. So we're trying, what we're trying to do is to sort of get this closer and closer to being able to correlate actual cases of pediatric cancer with the water in that very close area. We had hoped in one of these studies that we're now doing that we would be able to get a large number. I mean, they're not exactly a large number, but anyway, a significant number of people whose families have had a child with pediatric cancer and they still live in the same home, to get a sample of their water to compare with people where they haven't had pediatric cancers. We didn't have the resources to manage that well enough to achieve that aim, but we're still aiming at that. I do have a couple of slides here to show you the levels of atrazine in groundwater. Again, it's the same kind of a scheme where the darker reds are higher levels of atrazine in the groundwater, and the lower levels, the reds, those are the colors indicate the pediatric cancer incidence, and then the hatched areas are where there are high levels of atrazine too. And then, so that's for groundwater, where you see this whole area down here in southeastern Nebraska, where there's a lot of overlap between high pediatric cancer and high levels of atrazine. And you also see some similar stuff out here. And so that's in groundwater. You don't see as much correlation in surface water. That doesn't surprise us too much, but so we're able to distinguish between them. Out of the nitrate in water, which is what we've mostly been focusing on, of course, we want to see if we could target at-risk populations to try to help them so they can clean up their water before they're using it domestically. We need to educate better healthcare professionals so they can look for these kinds of problems. And we also need to talk to community leaders to affect policies, which Jesse's going to talk more about. We know that there are costs to trying to get the nitrate out of the water, whether you're a small town trying to deal with that in your city public water, or you're an owner of a farm and you have your own system. So we realize that there are economic issues here that have to be dealt with. And so what we think is that we think two things ought to be done. One is we think it's important for EPA to lower the impermissible level of 10 milligrams per liter down to something, maybe as low as 3, certainly as low as 5, based on on the data from other studies, and we know they're considering that, but it takes a long time. And also, we think that there ought to be regulations about testing private wells. I would say that there was money appropriated, and there is a program in areas that perhaps you already know about this, where the levels of nitrate are high, that you can get state funds to help mitigate the cost of putting in domestic filters or reverse osmosis, so that your domestic water from your well is much safer. So you've seen what we've been able to do thus far in this research, and I want to just show you all the people that have people and institutions that have collaborated with us on this. Our funders, much of the funding has come from families that have had children with pediatric cancer, and they want to try to prevent other children from getting pediatric cancer. And that's what I have to tell you, which leads into what Jesse's going to tell you. And I think, just let me do that. Maybe we should just take questions at the end of both of us.
So I'm going to talk about the next part of this, and that's taking this information and trying to figure out how we can actually translate that into some kind of action within our state. So before I do that, I want to talk about the history of public health just in general, and give you a little bit of background on what is actually public health. So, one, have any of you ever heard me give a presentation before? A couple. Okay. So, how many of you are familiar with Jon Snow? All right. How many of you are thinking about this Jon Snow? Well, I'm going to talk about this Jon Snow. He came a little bit before, maybe, depending on how you look at this timeline. So Jon Snow was a physician in London. And a lot of people think of him as one of the founders of public health. His story is like one of the founders of what we think of as public health. And Jon Snow was a physician. And he was a very creative and curious person. And one of the things that he's known for is anesthesia. Before Jon Snow, we really didn't use anesthesia. Surgery, different things were a very brutal process. Jon Snow, actually anesthesia was created by an American. It was a dentist. And they realized that you could use anesthesia either to help pull out teeth. Jon Snow saw this and said, you know what, we could probably use this for other things as well. Because a lot of people died in surgery at the time because it was such a brutal process. There was no way to sedate them. But Jon Snow is also known for one other thing when you look back in history, and that was cholera. And there's parallels here that I want to kind of talk about because it's relating back to water quality and relating back to understanding patterns and relationships. And so Jon Snow, at the time, the consensus in the scientific and medical community was that cholera was spread by bad air. You breathed in bad air, that's what caused you to get sick, and that's what was sending people, or that was what was killing people. And Jon Snow said, I don't think so. I think it's something to do with the water. And he was a very creative and curious person, so he went around, he was trying to investigate outbreaks of cholera and understand what was the potential factors that were causing people to die. And one of the things that happened was he was working in the Soho region of London, and there was a major cholera outbreak that happened and killed off a lot of people. And he was going through, and this is one of the first times that we use maps, he used maps, to understand the distribution of people that were getting sick and dying from cholera in Soho. And so this is actually his original map. Each one of those little black bars that you see is somebody that I believe either got sick or died, I forget, from cholera in that Soho region of London. So he went through and he was able to monitor all this. But still the scientific consensus at the time was, it's not water. It's probably something with the air. And so he came up with his hypothesis that there was something in the water that was causing these people to get sick. They went through, people were discrediting what he was saying, and kind of demonizing him even to some extent about some of the stuff that he was saying. Well, there's a very important person that was associated with this situation, and that was this priest, Whitehead. He served that population in the Soho region. And Whitehead, who's the priest that was in that area, he said, John, I think you're full of it. But he's like, I'll read your thesis. And so John Snow showed up, gave him his ideas, and showed him where all these relationships were happening, and showed him the maps and all this other stuff. Whitehead's like, let me read over it. He read over it, and he said to himself, I think this guy's actually right. I think there's something going on. There's a pattern here that's problematic. And so Whitehead and John Snow then partnered up and went into the community and actually started engaging and understanding where those outbreaks were going on and taking place. And they were able to piece this together and help inform the community. Now, there's a whole other side of it. They realized it was likely coming from this one pump that was in the center of this outbreak. And they realized that that's probably what was causing the outbreak. And then there's a whole story where they took the pump handle off so that people weren't collecting water from that area. People argued, put the pump handle back on. It was a whole back and forth story. And so there's multiple different themes that come from this. One, we need to observe and understand patterns, especially when we're talking about human health issues. Two, solving these problems is much greater than just observing the pattern and identifying the outbreak or the issue and trying to make some change. As John Snow realized, where they took the pump handle off and they had to put it back on. Also, you need local champions. If it wasn't for Whitehead, for that priest, this would have probably not even gone much further. And actually, John Snow died when he was in his 40s. Many people forgot all about his story and his history, but it was Whitehead when they were later, because at the time, they didn't understand germ theory, they didn't understand all this other stuff. And when finally somebody pieced it together and like cholera is actually in the water, which we now understand quite well, and they were like, look at this great discovery. And Whitehead showed up one day and said, no, there was actually somebody before this that was very familiar with this, and that was John Snow, who passed away. And so it was Whitehead that carried on his legacy. But he needed that local champion to help bridge that gap into the community. And then also, perseverance is key. Because when you're trying to address or deal with these issues, it takes a lot more than just showing up and saying, oh, this is a problem. There's a lot longer solution that needs to take place. And so that is public health. Public health can help with educating the public, can enhance our monitoring of issues that we see. It can help with researching so that we can better understand some of these relationships. And it can also help with contributing to the public dialogue so that we make sure that that information actually gets to the people. Now, the downfall is public health. We don't spend very much on public health. Public health is about 1.5 to 3% of all U.S. spending on health. So we spend a lot more on treating the problem or dealing with the problem after it occurs than actually trying to solve the problem before it occurs. And so that's part of what we're working on through the Water, Climate, and Health program. We're trying to understand some of the problems that are associated with environmental change in Nebraska and how that's impacting our populations, how we can build collaborations across the University of Nebraska, but also with people in the state of Nebraska to help trying to solve and understand some of our problems. And we're doing that through research, education, policy development, and training. I'd be happy to talk about that in more detail. But obviously, water quality is one of the issues that we're most concerned about. Nebraska, one of the things that we have is a lot of water, especially groundwater. 88% of our public water systems is groundwater. 95% if you exclude Omaha. A lot of people would exclude Omaha. 590 groundwater. There are 590 groundwater public water systems in Nebraska, and 583 of those serve less than 10,000 people. So most of our systems serve very small populations, rural populations. And so, talking about what Dr. Rogan was talking about, we have an opportunity to try to understand, address, and work with the communities to address some of these issues that Dr. Rogan was pointing out. In particular, I'm interested in how we can better educate and inform, especially our public health officials and people that are most at risk on some of these issues so that we make sure that they have solutions at hand. So first off, as Dr. Rogan talked about, we need to identify the populations that are most at risk. And those, in particular, are people that are on rural water, private wells in particular. And then for me, persons of childbearing age, households with young children, and some other populations as well. We need to encourage testing so that people, especially in private wells, understand what their water quality issues are. We need to find low-cost and no-cost solutions for these populations, so if we do find an issue, we don't just show up and say, hey, you have an issue, now we got to, good luck with that, but that they actually have something that they can implement to reduce their risks. And then we need to figure out how to maintain these systems as well, because that is a cost and that is a burden to those individuals. And so we did a study. This was with an MPH student. So this is just preliminary data. We want to expand this. Master's of Public Health student at University of Nebraska Medical Center to look at our healthcare workers, especially in rural areas. And so we contacted 32 clinics in rural Nebraska because that is the first line of communication with those individuals, especially those that are most at risk. We had 27 responses, and then we were able to compile their responses. Now, this is unpublished data, and this is pilot data. I'm hoping that we can make this much bigger, but it kind of shows the general trend. So, first off, of those public health those healthcare workers that we contacted, 78% of them said that they were somewhat concerned to extremely concerned about water quality issues and the impacts that they might have on human health. But 63% of those healthcare workers said that they've had little to no training on the water quality issues that they face in their communities. So they weren't able to, with that lack of training, they're able to communicate to those individuals that are most at risk. Most effectively. And then from that poll, most of them said that they have no materials available of understanding some of the water quality issues to educate their populations that they serve. And some of them said that they have online materials, which are, you can understand the potential limitation there. But they said, a lot of them said that they wish that they had materials that were available for them to help them be educated and understand some of these issues. And then also materials available, they need materials available for their patients so that they can provide that to their populations that are most at risk. And we're doing work on this. This is a process. We're moving forward. One, we have a curriculum project. we're working with the Department of Education here in Nebraska to develop a curriculum so that kids can go out and test the water, understand what is going on in their communities, so that way they can help educate themselves and educate the people in their community about some of the issues that they're facing. We're also helping co-sponsor an education campaign through the NDEE for across the state so that we can help educate and inform people. And then we're in the process of developing a nitrate drinking water brochure so that can be available to some of these healthcare professionals and others that are potentially at risk. And then recently we developed a source water protection position within Nebraska Extension to help with some of this education and make sure that we have boots on the ground that actually can help serve and educate individuals. So there are a number of opportunities. Sometimes when we talk about this stuff, it can be a little bit heavy. It can be a little bit depressing. But there are opportunities in addressing these issues. One, better research to explore and understand some of these relationships. Improving our education and outreach, especially with medical professionals and the populations that are most at risk. And making sure that we get monitoring into the households that are of higher risk as well. And then creating solutions, like I was talking about, so that there's actual way to reduce the exposure within those households. And we already know most of the solutions. We know the short-term solutions, and we also know the long-term solutions. So we're not having to create anything from the scratch. We can actually implement a lot of the stuff that we already understand in trying to address some of these challenges. And so with that, thank you very much. I look forward to any questions that you may have. And if you have any questions, or if you're interested, that QR code that's up there is actually for our Water, Climate, and Health program, so you can learn a little bit more about some of the work that we're doing. And so with that, I'd be happy to take any questions. And John, appreciate it.
Yes, as a homeowner, how would you recommend testing economically and reliably phosphorus levels in your water that you want to test, in succession? I worked in a lab a number of years, and they had these little strips tests, and I was so disgusted in trying to differentiate the levels because the change in the color was so small that I kind of gave up. In fact, I participated in a study, and I couldn't reliably put down what the level was based on that coloration. It's a colorimetric test.
Yeah, the water testing is definitely a big issue. There are multiple different potential opportunities in there. One of the opportunities is, one, working with your NRD to potentially get your water tested, and then they can do the official test. There's also citizen science testing that's out there. And so, and Ellie, you can feel, but the citizen science piece, I want to quickly mention this. This is being led by Shannon Bartell Hunt out of the College of Engineering. That's where they provide those sample tests that you're talking about, which are difficult to use. But we're actually working with a Dutch group obviously a Dutch group out of the Netherlands, but they've actually provided, or they're in the process of creating or they have already created, where you can take a photo of it and it can read that without you having to read it. And so it improves the reading of that, and it lessens the human error, which I agree with you is really tricky. And that is available, and we're in the process of trying to get that implemented here in Nebraska. We're hoping that we can do that soon. It's great. They actually used, this is getting the nerd part of it, but they used a machine learning algorithm to basically learn how to read those things so that you don't have to do it, and that the software can just do it for you.
I'd also suggest, I know Graham Christensen, our own Graham Christensen, has citizen water testing kits that you can talk to Graham about as well.
I have a question. These reverse osmosis systems, are they able to lower the nitrate in drinking water for household use?
Yeah, yes. That's actually, I think that's the system of choice for let's say, homes, sinks in homes, yes. I mean, you could put one, for example, on your kitchen sink, wherever the water comes in from the well.
Thank you.
But there is some caveats with that. And the two caveats that we should be careful of, if your nitrate concentration is too high, we still probably should be doing monitoring and testing after you put in one of these reverse osmosis systems, because I've heard that some of them are only effective up to a certain point. And so if the nitrate concentration is too high, the reverse osmosis might not be effective, or some of the filtration systems might not be effective enough. And so we have to be cautious of that. And then the other big piece of it is maintenance of these systems, because you can put one in, but if you're not doing regular maintenance on the system, it might not be effective. And so we have to be careful about that as well.
Do the reverse osmosis devices potentially compromise other valuable minerals and nutrients to the body? Is that a trade-off you have to do? And if so, can you address that in any way?
That I don't know.
I don't really know, Graham. I truly don't know. What I know is that they're recommended, and I can't tell you whether they've been calibrated so that they wouldn't take out valuable, let's say, minerals that are in there.
I'm intrigued about the curriculum that you're developing with the Department of Education. What is the rollout timeline, and where will it start? Will it be across Nebraska, or will it start in a particular area? Sure.
And this is we actually stumbled into this. And so the Department of Education, or the College of Education at the University of Nebraska-Lincoln, we found out that they were creating a really innovative curriculum. And it takes both sides. So it has the science piece, where the kids will go out into the field and actually measure and monitor what's going on in streams and areas of lakes around them. Then there's a social studies piece, where they're supposed to go back out and figure out how do they educate the public about this. So civic action around some of these issues. And I think that's the really neat part of this. And this is in collaboration. So they originally, it was a student, or he is a student, he's getting close to finish up his PhD in the college education at UNL. He was the one that kind of created this in collaboration with the Department of Education. And so it was such a neat opportunity to try to partner with and try to be a partner with. And we provided funding to help expand that. And so that's going to be a part of the curriculum. They've already done this. They've already been working with schools. And that was part of what we did, was help fund to make sure that more schools were included, especially rural, urban, all across the state, to get them engaged in this. And so they've done some of the initial testing, and eventually that'll be able to transition over so that any school can potentially do this.
Thank you both for what you've offered here today. Highly concerning, obviously. As a farmer, my suggestion would be to Dr. Bell possibly is to start communicating more with the agriculture area of the university, who is key in the state for putting out models of optimal levels of nitrogen applied to crops. And we key off of that data. Well, is the UNL, and they're under pressure from, industry and so forth, of certainly maximum productivity, which for multiple reasons, for farmers, profitability, and also for industry that wants the product, the output. But and there's also, the Fertilizer Institute involved, but there needs to be some collaboration here that says, are you all sure these are the right numbers? Can we cut these back and still productivity? Are we doing enough research there to get this
knocked back as far as we can. So we put out recommendations to the co-ops and to the fertilizer retailers and the agronomists of the state, and head some of the future off at least.
Yeah. Well, I see Crystal here, Crystal Powers, who's in extension, and I know she's been leading a lot of that work and trying to get better engagement, especially in some of these circles. And she actually developed a nitrate working group to help bring all these partners together in a more collaborative sense. I don't know, Crystal, is there anything that you want to add or anything else you want me to?
Crystal?
Okay. I know.
You guys don't need more slides. The things I will say is, so in the natural resource districts where they've been monitoring very closely for a long time in their high nitrate areas, we see pretty consistently 70 to 75% of fields are above university recommended rates of nitrogen application. And for consistently for a long period of time. And the same is true on irrigation. So that's the thing to remember. It's partially your nitrogen management and also your irrigation management, because that's the piece of this shows up under irrigated lands. It doesn't usually show up under dryland acres because it's that combination that drives the nitrogen down through the profile. So we got to step up our water management, step up our nitrogen management. And there is a large group working on that piece. And then the one other thing about that is some of our precision management methods are coming in 50 to 100 pounds lower yet than that static rate. So, we have this kind of static rate recommendation, but then, the future is in precision management and we can get even better. So this is a piece of what Jesse's saying of there are solutions out there. Some of our fields are already doing a very good job. We have data that shows where we're achieving lower than that 10 parts per million coming out. So we know we can do it. There's just a lot of fields to get there. So I'll stop there.
I'm going to walk this microphone back to John Hansen, but before I do, I want to thank again Dr. Bell and Dr. Rogan and share with you my thought about the first time I saw Dr. Bell's slide of the Game of Thrones Jon Snow. I thought he would be using it to illustrate the need for humility in the way we go about gathering data and drawing public health conclusions. And I saw in my mind the face of Ygritte saying to Jon Snow, "You know nothing, Jon Snow."
So thank you. My last question is, as someone who was a public official who dealt with water quality issues and had groundwater management responsibilities starting in 1974 to 90, when I worked with the University of Nebraska with a whole host of federal agencies, state agencies, local agencies, they all looked at me and said, "He's going to talk about this again, isn't he?" And the answer was, yes, I am, because here we have all of these different kinds of sampling systems and water quality, quantity, gathering mechanisms. But my complaint and my goal as from that complaint was that we just really needed to have a better, totally integrated system so that we could gather as much information as possible, put it in a common area where it was all accessible, but also do a little bit of coordination so we could make a little more sense out of what it is that we were knowing, so that as people who were responsible for water management issues, we had the data that we needed in order to make informed public policy decisions. So based on my years of whining and complaining about the lack of that, gee, where are we?
We still have a ways to go. But, I have to say there was one recent development. NDE has created a more user-friendly repository around this, where you can actually see and access some of the groundwater, looking at groundwater contamination and conditions, ground and surface water. But we still need more monitoring across the state. And that's a big limitation that we have. We just recently, in partnership with Nebraska DHHS, got funding to develop a through CDC to develop an environmental health tracking program here. in the state. This is the first time that this has been within the state. It builds our capacity. And part of that will be able to hopefully have some of this environmental data so that people can see this for themselves and where we have higher concentrations of certain issues and where exposures are happening across the state as well. And then be able to relate that back to human health issues. So we're hopeful. Does that answer your question to some extent? We're moving forward. We're not there yet. How about that?
Well, as somebody who started raising that issue in 1974, I'm really encouraged to know that we're making progress.
Only 40 years later.
So there we are. You can't manage what you can't measure. And, when push comes to shove, data is so critically important to the management part of all of this. So we have had an outstanding presentation this afternoon, and let's give them all a very big hand.